Madam Speaker, I rise today to share with you the story of Barrett. Now, I went to high school with Barrett. I hadn't heard from him in a couple years, and I was honored when he chose to share his personal medical story, not just with me, but asked me to share it with the people of the country and my colleagues here in the United States Congress as a way to encourage them to help support health care reform. Barrett has been living with diabetes, like many millions of Americans, for about 35 years. And yet, Barrett says, the biggest battle he faces is not the battle with the disease. The biggest battle that Barrett faces is his battle with the diseased health insurance system. Barrett has no complications due to his diabetes, yet every year his insurance plan finds new and creative ways to increase his premiums with, of course, no benefit to him. For the last 7 years, Barrett used a product called Lantus insulin to survive, but his insurance company hasn't added it to its formulary. His insurance company states that it's not necessary to his overall health. Well, the reality is, says Barrett, if I don't take it, I die. Sounds necessary to me. Plain and simple, Barrett shared with me, insurance companies make more money from non-formulary drugs, substantially more. The insurance companies and drug product companies are turning huge profits. These two conglomerates understand there's a lot of money to be made. Let's face it, Barrett says, the health insurance industry has become nothing more than legalized extortion. You know, there are millions of Americans like Barrett. Americans who, because of a pre-existing condition, through no fault of their own, any of us could be born with or develop diabetes. Anybody could develop cancer. I had a friend who's healthy lifestyle, worked out, he biked a lot, 41 years old, had a heart attack. You know, it can happen. That's going to be a pre-existing condition for the rest of his life. Too many of Americans bear the scarlet letter of pre-existing conditions, like my friend Barrett. In healthcare reform, we ban pricing discrimination and exclusions based on pre-existing conditions. 1. 2, we empower consumers with choice through an exchange, forcing insurance companies in some markets for the first time ever to have real competition with one another, including a public option. 3, we provide affordability credits to help middle-class families afford health care. Barrett asked, what is the cost of my health to my wife and daughters? Barrett says, I would say it's worth more than the annual bonuses the executives get on top of their six-figure salaries. Well, I agree with my friend Barrett. The life of Barrett, the health and financial security of his wife and family, the health and financial security of tens of millions of American families is worth more than the bonuses that insurance executives get. I call upon my colleagues to support the Barretts of the world in your district and join me in supporting health care reform. Thank you, Madam Speaker.